So I am doing my project on iron deficiency anemia within Italy and the United States. So what exactly is iron deficiency anemia? Anemia occurs when you have a low level of hemoglobin in your red blood cells. And hemoglobin is the protein responsible for carrying oxygen to your tissues. So your body needs iron to make the hemoglobin. So when your body is iron deficient, it lacks the proper amount of hemoglobin needed to carry oxygen to your tissues. When there isn't enough iron in your bloodstream, the rest of your body cannot get the oxygen it needs. Therefore, you have anemia. Iron deficiency anemia is the most common type of anemia. While the condition may be common, many people don't know that they have iron deficiency anemia because the symptoms don't show right away, or the symptoms could be showing and people just don't realize why they do have those symptoms, and it goes undiagnosed for a lot of people. Some symptoms of iron deficiency anemia are general fatigue, weakness, pale skin, shortness of breath, dizziness, strange cravings, tingling or crawling feeling in your legs, tongue swelling or soreness, cold hands and feet, fast or irregular heartbeat, which could also lead to heart problems in the future, also an enlarged heart, brittle nails, as well as headaches. Some of the causes of iron deficiency anemia. You can get iron deficiency anemia from a simply inadequate iron intake. Your pregnancy causes anemia. You could have a situation in which you lost a lot of blood, internal bleeding, inability to absorb iron at all, so you could be getting the amount of iron you need, but your body just is unable to absorb it. Endometriosis and iron deficiency anemia is also genetic. So if you have family members with iron deficiency anemia, especially your mother, you have a greater chance of getting iron deficiency anemia. Fun fact, my mother is anemic, so I have been showing borderline signs my whole life, and I definitely have been diagnosed recently. A couple possible risk factors for iron deficiency anemia. Anemia is a common condition that can occur equally in both men and women at any age from any ethnic group, although women are more at risk, which we'll learn about in later slides. Some people may be at greater risk of anemia than others, including women of childbearing age, pregnant women, people with poor diets, people who donate blood frequently, infants and children, especially premature babies, vegetarians, and additionally, again, women are at a higher risk of anemia simply because of menstruation. When diagnosing iron deficiency anemia, there are a few different ways doctors can test for anemia in your body. Different types of blood tests can be used to diagnose iron deficiency anemia. The first most common type is the CBC test, complete blood cell test. A complete blood count is usually the first test used. It measures the amount of all components in the blood, which include red and white blood cells, hemoglobin, platelets, as well as hematocrit. The CBC provides information about your blood that is very helpful in diagnosing iron deficiency anemia, like the hematocrit level, which is the percent of blood volume that makes up your red blood cells, your hemoglobin level, as well as the size of your red blood cells. So if your red blood cells aren't the size they are supposed to be, that is a very good indicator that you have iron deficiency anemia. Anemia can also usually be confirmed with other blood tests. Your doctor might perform these additional blood tests to determine how severe your anemia is, as well as to help decide your future treatments. These tests can determine your RBC size and color. If your cells are pale, it normally means they are deficient in iron. Your ferritin levels, as well as your iron binding capacity, which is known as TIBC. Another good indication that you have iron deficiency anemia is if you pull down the lower tear ducts of your eyes. That's all supposed to be red on the inside. If your tear ducts are white or even a pinkish color on the inside, that is a good determining factor that doctors use to help diagnose you with iron deficiency anemia. Iron deficiency anemia can also provide additional health complications as well. You could experience rapid or irregular heartbeat, which can lead to heart failure or an enlarged heart if not treated. If you're iron deficient and you're pregnant, you can have a premature baby as well as labor and delivery problems. If you are also iron deficient while you give birth, your child could have delayed growth and development. Possible treatments for iron deficiency anemia, the most common is iron supplements. You can easily take an iron supplement pill. They mostly require you to take them on an empty stomach so your body can fully absorb and digest the iron without having anything else needing to absorb it. But they tend to be very harsh on your stomach, so most people like to take them with food. Your body will still absorb it the same way, but it's just easier if the body has it on an empty stomach. If you don't want to take iron supplements, updating your diet is also a good way to prevent your iron deficiency. Foods that are rich in iron are red meat, dark green and leafy vegetables, dried fruits, nuts, and iron fortified cereals. So eating those will help improve your iron level in your body naturally. Additionally, vitamin C helps your body absorb iron. So if you increase your vitamin C intake with a glass of orange juice or any citrus fruit, it could also help you with your anemia. If your anemia is a result of internal bleeding, a blood transfusion may also be needed to cure your anemia. Preventing iron deficiency anemia. Iron deficiency anemia can be prevented by eating a high iron-rich diet with foods and vitamin C, such as the foods mentioned on the previous slide, as well as the foods listed here. So, foods high in iron include meat, such as lamb, pork, chicken, and beef, beans, pumpkin and squash seeds, leafy greens, such as spinach, raisins, as well as other dried fruits, eggs, and seafood, such as clams, sardines, shrimp, oysters, as well as iron-fortified dry and instant cereals. You could also increase your vitamin C intake. Foods that are high in vitamin C include fruits like oranges, grapefruits, strawberries, kiwis, guavas, papayas, pineapples, melons, and mangoes. Broccoli is also rich in vitamin C. Red and green bell peppers, Brussels sprouts, cauliflower, tomatoes, as well as leafy greens are all also rich in vitamin C. So eating all of these foods can help increase your iron absorption and your iron intake, which could help you prevent iron deficiency anemia within your body. So while iron deficiency anemia can affect both men and women, women are definitely more predisposed to anemia than men simply because they do menstruate every month and they are experiencing lots of blood loss. Some of the physical, mental, and emotional implications that women experience with iron deficiency anemia are a gloomy feeling, bad memory, weakness, lack of energy, dizziness, a feeling of hard to focus and lack of concentration, also a lack of motivation, feeling fatigue, and heavy-headed feeling. So iron deficiency anemia definitely takes a toll on your mental and emotional aspects, and it's not all just physical. So now iron deficiency within the United States is the most common nutritional deficiency. Anemia is definitely the most nutritional deficiency diagnosed. The United States ranks 81st in iron deficiency related deaths and diagnosis out of worldwide. So the United States ranks 81. A significant prevalence was observed in the United States during the early 90s among certain populations, such as toddlers and females of childbearing age. So toddlers had a high prevalence because they were being born with iron deficiency anemia due to their mothers having it while they were pregnant. One of the national health objectives for 2010 in the United States was to reduce iron deficiency in vulnerable populations by 3 and 4%. They were able to lower it a little bit for a short period of time, but it stays pretty constant and consistent within the past 9 years. According to the CDC in '98, the estimated prevalence of iron deficiency was greatest among toddlers aged 1 to 2 years and adolescent and adult females aged 12 to 49 years. The prevalence of iron deficiency anemia was approximately 2 times higher among non-Hispanic Black and Mexican American females than among non-Hispanic and white females. So toddlers, again, and adult and adolescent females were the most at risk because iron deficiency anemia forms around childbearing age, and then if it's untreated, it gets passed on to the toddlers. Non-Hispanic Black and Mexican American females were also at a higher risk than white females, probably because it is less noticeable in white females. So it went more diagnosed in the non-Hispanic Black and Mexican American female category. Some statistics, according to the HRF in 2019, for the United States and iron deficiency anemia, 10% of persons aged 65 and older have been diagnosed with anemia in the United States. 1 out of every 5 women who become pregnant will struggle with anemia at some point during their pregnancy. Based on the body iron model, 14% of children under the age of 2 are considered to be anemic. The number of deaths that are annually attributed to iron deficiency anemia every year is almost 5,000. 4,988 number of deaths are recorded in the United States. Up to 12% of the women in the 12 to 49 age demographic will need to be treated for anemia at least once in their life. Approximately 700,000 toddlers and 7.8 million women are either living with iron deficiency anemia or will be diagnosed with it in the coming year. And the percentage of adult men who suffer from iron deficiency anemia is 2%. So it is much more common in women. The second country I chose to look at for my project is Italy. I am 75% Italian, so I was just curious to see if there are any similarities, differences in how women experience iron deficiency anemia within the United States as well as Italy. Some interesting facts. Italy ranks 66th in iron deficiency anemia related deaths. Now, as we mentioned back in a few previous slides, the United States ranked 81st. So Italy is a little bit higher in iron deficiency deaths. Clinical signs of severe deficiency are not observed in Italy, and the incidence of vitamin malnutrition is moderate. This is probably due to the large availability and variety of food and Italian eating habits, which reflect the typical Mediterranean diet. The typical Mediterranean diet in Italy consists of rich cereals, fruits, vegetables, as well as olive oil. There are particular conditions linked to lifestyle in which the risk of a mild or moderate vitamin malnutrition increases. These include a monotonous diet, drug interactions, smoking habits, as well as alcohol consumption. Italy's is slightly behind the United States in medicine and insurance advances, so treatments for iron deficiency anemia are limited, making chronic issues more prevalent. So some similarities between iron deficiency anemia in the United States and Italy. Culturally, the US and Italy experience iron deficiency anemia the same, and the symptoms are the same across the board. People in Italy and the United States experience their symptoms the same. Religious views do not impact iron deficiency anemia. It is simply varies from body to body. Religious views have nothing to do with it. Diet plays a role within both countries. Because Italian food is so popular within the United States, people do consume fairly similar diets and meals on a daily basis. Iron deficiency anemia affects babies the same way in both countries. If a mother is anemic, the chance of their pregnancy or baby developing iron deficiency anemia and experiencing complications heightens. Anemia is popular in women more than men in both Italy and the United States due to menstruation alone. In both countries, women are more prone to iron deficiency anemia around childbearing age. So between 12 and 49 seems to be the age range where both countries, the United States and Italy, seem to experience the most diagnoses of iron deficiency anemia. There are some differences between the United States and Italy as far as iron deficiency anemia is concerned. For one being, Italy ranks higher on the mortality scale. They are 66th. The United States was 81st. This could possibly be because lifestyles are different. Italians live differently than people in the United States do. In the US, lifestyles are constantly on a cycle of working, caring for families. In Italy, lifestyles consist more of everyday alcohol consumption, smoking, consuming carbon-rich diets, which could potentially lack the proper amount of nutritional iron needed. In Italy, foods constantly consumed in the culture are pastas, pizza, salad, and lots of alcohol. So these foods are not really rich in iron. Unfortunately, those foods are also very common in the United States, which could also lead to more United States diagnoses as well. In the United States, we place a heavy importance on the food pyramid and making sure we get a balanced blend of vitamins and nutrients every day. So we in the United States are more conscious of the foods we're putting in our bodies and making sure we get a well-balanced diet. The United States has more access to blood tests and accurate diagnosis. So here, with medical insurance and doctors being more readily available, people can be diagnosed with iron deficiency anemia quicker and more easily. People pay more attention to their food intake in the United States overall, which makes it rank lower on the mortality scale than Italy. So what's being done in the United States regarding iron deficiency anemia? Within the United States, awareness has been raised regarding anemia. Individuals are becoming more and more aware of the signs and symptoms, as well as the severity of undiagnosis. If someone is anemic, proper treatments are being sought out, whether it's supplements or simple dietary changes, in order to reverse their iron deficiency anemia. In the past 3 decades, parents have increased their child's iron intake, which has declined the rate of iron deficiency anemia in infants. So because parents are being more cautious and careful about what they're consuming, it leads to a lower infant iron deficiency anemia diagnosis rate. As a result of the decline in infant iron deficiency populations, screening tests are also becoming more obsolete because less and less children are being born with iron deficiency anemia. Women who are within their childbearing years have also increased their iron intake as well, even if they're not at risk for anemia, just in case they were to develop something that could potentially cause harm to their pregnancy or their baby. What's being done in Italy? In Italy, if someone is needing treatment for iron deficiency, the most common remedy is dietary changes. People are trying to eat more iron-rich foods because it is a cheaper alternative than seeking medical alternatives. For pregnant women in Italy, most don't even know they are anemic and have no idea that their pregnancy could be at risk, so they are developing more access to blood tests for accurate diagnosis for not only women that are pregnant and could be at risk, for all women and men everywhere, so that they can get an accurate diagnosis more easily and without any hassle. Italy all around needs to be more informed about iron deficiency anemia. They definitely are not as informed about it as the United States is, and definitely not as cautious as the United States is. They are higher on the mortality scale, so they definitely need to work on informing their populations about the severity of this nutritional deficiency. So, in summary, ultimately, in the end, the US and Italy are very similar, but also very different when it comes to iron deficiency anemia. Women are definitely the highest at risk in both countries. Access to blood tests are definitely easier within the United States, which leads to more diagnoses and treatments. Lifestyles within the two countries are different. They are very similar, but they are also very different. Symptoms experienced are the same in both countries, United States and Italy. The age ranges in women that are the most commonly diagnosed are the same, childbearing years, age 12 to 49, and diet affects both countries. So if you don't have the proper foods and minerals going in, you definitely are more at risk for iron deficiency anemia. Italy definitely needs to have more awareness to iron deficiency anemia to bring down the mortality rate. All in all, people need to incorporate more iron into their daily lives in order to knock anemia off the #1 spot of vitamin deficiencies within the United States as well as worldwide.